Hello, this is Robert Rickover. I'm an Alexander Technique teacher in Omaha, Nebraska. I also teach regularly in Toronto. My guest today is Imogen Ragone, who's an Alexander Technique teacher in Wilmington, Delaware. And what we both have in common about teaching is that we both teach online primarily these days. And this is a podcast that's really primarily for Alexander teachers and students and trainees. It's not, I think, unless you're familiar with Alexander concepts like direction and inhibition, probably what we're talking about is going to not make a whole lot of sense to you. And Imogen has no idea what we're going to talk about.
It always is interesting.
But that makes for some nice conversations. This is I've been thinking a lot about both inhibition and directions that are kind of aimed at producing inhibition, as it were. Especially in the last few months after there's been quite a bit of attention to Margaret Goldie's work approach to teaching, and her Margaret Goldie was a first generation teacher very close to Alexander, who kind of went in her own direction. She did not have a training course, but she did teach until she was quite old. And she was not she was sort of separate in many ways from the other second generation teachers in her ideas about what Alexander's work was all about. She placed a tremendous amount of influence on inhibition, or what she called stopping. And I've reread some books about her and been thinking a lot about what she had to say, and especially with regard to what are called negative directions. And for anyone who's not familiar with negative directions, I'll put a link to some material on directions in general, including negative directions. Basically, they're statements about what you don't want. So a classic negative direction could be, I'm not tensing my neck, I'm not compressing myself, things like that. So they are sometimes even called inhibitory directions for that reason. And there are really two types of negative directions. One type is the kind I just described, where you're saying, I don't want to do this. It's saying,
yeah, you're kind of being really clear about what you don't want.
Yeah. You're saying no. Mm-hmm. I don't want that. You're not, and that's what your conscious brain is doing. And the rest of your brain and nervous system and body figures out, if you get out of the way, the rest of yourself will figure out how to do the best job possible to make that happen. And so that's one type. Where there's a kind of an outsourcing going on. This part of your brain comes up with the idea to think that direction, because you, from experience, maybe it's helpful. And then it steps back, or never really steps forward. It just says, that's what I want. And then the rest of you takes care of it. The other type of negative direction that's related to it, and I know it's one of your favorites, and it's certainly one of mine, are what are sometimes called paradoxical negative directions. And that's a direction of the sort, well, if you're moving across the room using your legs and people looking at you might say, well, you're walking, but the direction is I'm not walking. You're basically saying I'm not doing the thing I'm doing, that it appears that I'm doing. Hence the term paradoxical, I guess. And what I think they're all about is you're saying when you say I'm not walking, what you're really saying is I'm not walking the way I usually do. And implicitly, there's kind of a second phrase there. So body, mind, the rest of me, apart from this prefrontal cortex, figure out how to do that. It's your job to make that happen. And again, it's a kind of an outsourcing process. You're saying what you want. Strange thing, your body figures out, oh, okay, we're gonna
So you
give.
obviously, they're interesting because you obviously have the intention to walk. You do want to walk, but
You're,
your direction is I'm not walking. So
meaning, you're not walking. I'm not walking in my usual way. Find another way. And here's where it gets really interesting. If you ask that of yourself, logically, it should be a 50-50 chance that it'll come up with a better way. It might come up with a worse way, right? Could say, oh, okay, you want a different way of walking? I got one for you, where you're going to be clunking even more loudly on the floor with your feet. Logically, that would be the case, perhaps. But
I am thinking actually not, but I see what you mean. But
well, and but that never happens if you deliver that direction in the way that's with no intent.
The thought that just occurred to me is because you actually have to do more to do a more
but your body could say, so okay, we're going to make it worse for you, or we're going to make you do it with greater effort. But that never happens. That's the thing. So given that, it seems like we're already getting a sense that maybe the rest of your body, apart from this controller up here, your prefrontal cortex, maybe it's got some intelligence of its own, and maybe quite a lot of intelligence of its own, because it not only hears what you're saying, but it makes judgments about what's the best way to produce that. It doesn't just take you literally. It says, well, I'm pretty sure he doesn't want me to walk more heavily. So we're going to stay with improvements in how you move. Right? That requires some intelligence that's not at a conscious level. And even the ordinary negative directions, I'm not tensing my neck. In order for your body to implement that, your rest of your nervous system and your body to implement that in a useful way, it has to be a whole body thing. It can't just be your neck that it's going to focus on. So again, that part of you, which is most of you, that you outsource this intent to, it's got to be pretty smart. So even though that smartness is not, the workings of that smartness are not necessarily evident to you. You're not conscious of it. When I say I'm not walking and I'm walking and I put out that thought and my walking is easier, I can notice that, but I have no idea what the rest of me was up to make that happen. Absolutely no idea at all. It's totally out of my awareness. So go ahead.
Yeah, so just one thing that occurred to me as you were talking about that, and talking about that we have this intelligence in our body that's not conscious,
right.
Or in ourselves, that relates to when we get out of our own way, that the way we are designed, the way we function is to try and do things that will help us, that to move and be in the most beneficial way for ourselves. I'm not expressing this well, but hopefully you get the idea of what I mean. That
that your body, when you deliver that message, your body doesn't just blindly do it without any consideration of the fact that it's you who's delivering the message and it's
yeah,
about you. It has your best interest at
that's
heart,
yes,
and
yes,
it will
always.
always, yeah. And so even with the kind of negative and the paradoxical directions that have been around for quite a while, that's true. But having explored Margaret Goldie's work a lot more, emphasizing inhibition, I started playing around with directions that I thought could directly be a way of inhibiting. And for example, you might even just say, I'm stopping. That could be a direction that might do that. The one I'm tending to use a lot these days is, it's, as far as I know, I'm the inventor of it. Maybe someone else did earlier, is I'm not doing. It's kind of an odd phrase because usually you think I'm not doing X or Y or whatever. But I think just I'm not doing
Mm-hmm.
as a self-direction is incredibly powerful. And the thing about it is that it could be either a straight up negative direction. Right? I'm not doing this. I don't want to do
Mm-hmm.
this thing. But it's I'm not doing is really about anything you do. And clearly you're going to be doing things as you think that. Right? You're
Yeah, I
going
may not have
to
used those exact words, but I'm sure I've used very similar. But and to me, it's the idea that we're, and maybe this is a kind of learned Alexander way of thinking about the word doing, but we're often doing much more. So not doing means doing less. I
oh,
mean, we're
no
always
more
doing
over,
something,
not
right? But I'm,
overdoing, not
yeah,
overdoing.
yeah, yeah.
But in some situations, it may mean more like a paradoxical direction. Okay, you're using this direction. You're going for a walk as you're using it. Uh,
Yeah.
you're
So you
certainly
are
doing
doing
something.
something. Yeah. Mm-hmm.
So it's not saying no doing. In that case, it's just saying, how about a better way of doing? So that direction I'm not doing covers everything, really. It covers any possibility.
Hmm.
And the to me, the intelligence needed to do that, to accomplish that, is pretty amazing. That unconscious part of you has to really get, okay, no doing, no excess doing in this case. Yep. So if they're tightening their neck, if that person's tightening their neck when they say that, uh, we're going to figure out a way to lessen that tightening. If the person's doing a movement, well, obviously they're doing it and we're not going to stop them from doing it. So we're going to see if we can't get them to do it in a easier, less, more effective way. Well, that requires a lot of calculating and figuring, right? That's not some simple thing. And
And
I
thank
think
goodness that I don't need to do the consciously
exactly.
don't need to do the calculating and figuring. Yeah.
But I
Yeah.
think in general, like the outsourcing paradigm, well, this guy comes up with the idea, your prefrontal cortex says, this is what I want. And then it outsources it to your body. It could be, you could think, well, maybe your prefrontal cortex is the real kingpin in this situation. That's where the action is. And it just tells the body what to do, and the body kind of figure it does it without a lot of thinking about. But I think it's maybe almost the opposite. It doesn't take a lot of intelligence once it's explained to you to use an Alexander direction. You just use it, right? I'm free,
Mhm.
or my neck is free, or I'm not tightening my neck, or any direction. You don't have to know a whole lot or do a lot of thinking to use it. There is an art to it. You have to learn how to do it without sneaking in some implementation. There are definitely challenges.
I'm interesting,
Mm.
just because often I'd say without doing something extra so that I'm not doing is brilliant, because that's all is in there already. I'm not anyway.
Well, I mean, to actually think the thought I'm not doing
Mhm.
is not in it can be challenging to continue that thought, as if, for example, you're thinking it and suddenly there's a big change that you notice,
Mhm.
and you think, wow, what's going on there, and your mind goes to that and leaves the thought that caused it. There's that kind of challenge. There's this great temptation to try to help, you know, if by thinking I'm doing and not doing anything to make that happen brings about a nice result, maybe if I add a little oomph to it,
Do, but that's why
it'll,
I'm thinking I'm not doing is so great, because you'd have to do something
yeah,
to add to it, and that's the opposite of what the thought
exactly,
is.
yeah.
Yeah.
So,
Yeah.
I think it's easy to think, if we that okay, the prefrontal cortex is really the decider, the conscious brain. It's like our highest level of being mentally and all the rest of it, and that outsourcing just kind of that's like lower level stuff. But I'm starting to wonder, and this is I don't know the answer, but I'm starting to think it might be exactly the opposite, that that
So we have this
body
low level thing that we can do, and it's a
pretty low
higher
level, that
um
actually the body wisdom for the most part is out of our consciousness, and for a good reason, because it involves so many things. We have so many joints and muscles that our consciousness can't really deal with that.
mm-mm.
But our body can deal with it just fine. And that to me suggests that it's pretty damn smart. And that really, like, thinking a direction is a little bit like turning on a light switch. Doesn't require a lot of smarts to do that, and you suddenly activate this entire electrical system for your benefit that extends out, from
Yep.
the wiring to, substations to generating plants.
No.
All of that stuff is
Mhm.
going on in the background, and you don't have to understand any of it. All you have to do is just flick a switch or turn on your computer. You push a
Mm.
button and suddenly your computer's on, and all of this stuff's then happening,
Mhm.
that is far more intelligent, requires far more intelligence than just pushing the button to turn your computer on.
Yep. Yep.
So that's really kind of what I'm getting at here. And it's not, it's, I just want to add two things. Well, first of all, before I add a couple of things, do you have anything else you'd like to add
Um
to that
n-
general idea?
not not particularly right in this moment. I will jump in if something occurs to me. Yeah.
Yeah. So,
Um, although
yeah.
the words body intelligence did pop into my mind, which is what I because you've talked about your
That's
body's intelligence, body wisdom, which actually
that's
body wisdom is the name of an Alexander journal on Medium.
right, right.
But body intelligence is the words I use for my approach to the Alexander technique in my business. So
Right. And I'm starting to think that a large chunk of that is out of our consciousness. That
yeah,
really the
it makes sense to me. It
yeah.
makes sense to me. Yeah. So
Now
your
there's
two final points. Yeah.
yeah, two final points. I hope I can remember them. Um, this model of the prefrontal cortex coming up with ideas and the rest of the nervous system and body responding may well be, it's a model, and it may well be an oversimplification of what's going on. I don't think there's a sharp separation between the two. I mean, they're both in the brain, they're interconnected with nerves and so on. So I would take the model as not necessarily literally the case, but I think there's some truth in the model that it's worthwhile to have it. But the other thing I want to say is that direction, for example, I'm not doing. It'll work just fine whether you're interested in what we're talking about or not, because we're not really talking about the effectiveness of it, which it is extremely effective. I think you would agree, and my students really love it. And you can learn a lot by using that direction, starting with just thinking about activity, and then going into some simple activity with that intent. I'm not doing. But you don't need to know all the stuff that we've been talking about. But I think it's just interesting. So I don't know what the practical implications of this are. It's more, for me, it was more, well, where is the decision making really going on? Yes, some of it's definitely going on in your conscious brain, but I think the vast majority of it's going on totally beyond, outside of your consciousness, and that's just fine.
I wish I could remember the statistic, but I was reading some book that may have had a neuroscience sort of bent to it. I can't even remember,
Right.
but it was you know, we think we can, the vast majority of what we're thinking, what we're deciding, what we're choosing, everything is before the conscious brain is even involved at all. So but we can learn, as we do in the Alexander technique, for the tiny percentage that we can, bring our conscious brain to work and to actually help then what's going on with the rest. You know, I guess it's kind of giving nudges to
and those nudges are important.
Yeah,
If you
really important.
develop, let's say, a habit of moving, you have an injury, and you distort your way of moving to protect the injured part of you, and the injury heals, but some of that protective stuff remains, and it's creating some tensions in your body that could show up years later as pain or discomfort. It's because they're really that intelligent body that we're talking about. It seems as though it needs something to tell it to change. It doesn't automatically self-correct. It's my
Well,
sense.
we could go down the whole rabbit hole of habit, and we need, but that's our, you know, unconscious, subconscious brain, so that we don't have to each time, like we're doing something from scratch and having to, you know, but obviously then we create patterns that are a little bit less useful. So this consciousness part can bring the body intelligence back into
it has to make the
those other.
request.
Yeah.
And I
Yeah.
think that's, in a way, what Alexander was talking about when he has titles of books like Man's Supreme Inheritance or Constructive Conscious Control or The Universal Constant in Living, that if something's amiss with how you're functioning, most people try to fix that by doing something additional, and they're basing that decision on what things feel like, which could be quite inaccurate. And so Alexander's big thing, one of his big things is we need to move to a higher level, higher plane. And I think that higher plane is realizing that you've got a conscious mind that is capable of issuing instructions. He called them orders. I'm not crazy about that term, but just statements about what it wants. And that is a necessary, that's in its own way a much higher plane of operating. You have the conscious brain indicating what it wants, and then letting the rest of the body take care of it. That's the higher plane, I think, that Alexander was talking about. I don't think he would have thought of it in quite those terms, because I don't think he had a background in neuroscience, because really nobody did in the 1890s, which also, by the way, makes his writing at that time so fascinating, that he intuited in his own way that discovery without any, no one was talking about mind-body unity or mind and body being the same thing, and that you needed to move away from responding just to feelings to, what he would consider a reasoned way of affecting things. But all of that takes you to, well, if you want to change, you got to have the right instruction, but you need to just make it clear what it is, quietly and softly clear, and then let the system take care of it. You don't need to go and exert yourself to make the change. Let the body do it. So anyway, that's all I have to say. You want to add anything to this?
No, not right now. It was really interesting talk, because I had no idea what we were going to talk about. So
right,
as
most of the time.
What
yeah,
kind of came to me as you were talking that through, but it makes sense to me.
Yeah. So these are really just my preliminary thoughts, and certainly interested in getting feedback from teachers and students of the technique. And who knows, maybe we'll end up doing a follow-up interview on it. So there it is, Imogen. Thank you. My guest has been Imogen Ragone, an Alexander teacher in Wilmington, Delaware. And thank you, Imogen, so much for doing this.
Thank you.